Hippocrates said, which is the father of modern medicine, he said, let your food be your medicine and your medicine be your food. Unfortunately, most healthcare providers do not have a comprehensive understanding of nutritional medicine, and very few discuss it with their patients. This is why it's so important for you as a healthcare provider to understand this topic and to provide evidence-based recommendations to your patients. And this is the whole point of this presentation. And then there are new animal studies that report that these diet-induced epigenetic changes are not limited to one generation, but can actually ripple down to descendants. So the foods that we choose for ourselves and our family and the diet our patients will follow will not only impact us and them, but also generations to come. So let's jump into our first diet. The first diet that we are going to be discussing is the elimination diet. We as functional medicine practitioners use this a lot with our patients. This diet is about removing foods for a specific amount of time to pinpoint specific food reactions that may be occurring with your patients. Some of the primary foods that should be removed during this diet are some of the main culprits seen to be reactive in people. These include foods like wheat, eggs, soy, peanuts, and dairies, and sometimes nightshades such as peppers and eggplants. And a big thing with the elimination diet is there are a lot of hidden sources of foods in such things as like dairy, eggs, soy, or in packaged foods. So what we are trying to do is educate our patients on how to read labels and how to specifically read possibly hidden sources of those ingredients. For instance, here with dairy, you can see that your patients might not know that caramel candy or caramel flavoring may include dairy, or things like coconut cream flavoring may include dairy as well. So these are some of the things that you want to educate your patients on with looking for hidden sources of foods. And you can refer back to this, print this section out, and you can actually give this to your patients as well. And then with the elimination diet, some of the foods that should be included in this diet are going to be fruits, excluding some citrus, high quality animal proteins, gluten-free grains, healthy fats and vegetables, sometimes excluding nightshades depending on what you are trying to do with your patients, and then wild caught fish and seeds. This is just an example of what an elimination diet might look like. This is a 2-week or a 4-week elimination diet. Notice here in both of the challenges, you are going to see a reintroduction phase. And this is what you will be doing with your patients with the elimination diet. There is going to be a reintroduction phase in which you are seeing if symptoms occur with reintroducing certain types of foods. If they don't occur, then you can have those foods in moderation. However, if that patient is still having some sort of food reaction when you reintroduce that food, you should have them avoid that food for some period amount of time. Usually until, I would say, about 1 to 3 months while you focus on healing their gut. Once you have healed their gut, then you can look at possibly reintroducing those foods back in and seeing if they're still reacting to those foods. And then some of the benefits of the elimination diet is I've seen a lot of patients have a reduction in brain fog, fatigue, anxiety, depression, and then also it helps with symptoms that are associated with conditions such as IBS, dysbiosis, ADD, and autoimmune conditions. Also, some skin issues I've seen the elimination diet be helpful for as well. The biggest thing with the elimination diet is that we are removing food reactions, which will decrease gut inflammation, thus decreasing the associated symptoms of gut inflammation, like migraines, IBS, dysbiosis. And then in this picture here, this is showing the immune and non-immune mechanisms underlying food intolerances, in particularly IBS. So the simplest mechanism is a food allergy, which is shown on the left-hand side here, which is typically caused by foods such as shellfish, peanuts, and other tree nuts. This is based specific on IgE antibodies, which is bound to the surface of mast cells found throughout the body and can be easily detected by a simple blood test. And then in the middle here, it's going to show an oral ingestion of antigens, which activates mast cells throughout the body, giving rise to symptoms such as urticaria, which is hives, asthma, as well as gut symptoms, which is usually pain or diarrhea. With this picture, it's also important to mention that mast cell activation can be limited to the gut, where their activation is more difficult to document, and traditional allergy tests such as specific serum IgE or the skin prick tests are negative. Some animal studies report that mast cells in the gut can react to food. However, the specific IgE was not found in the serum, which would mean that current tests used to detect specific allergies would be negative. These gut mast cells can also be activated by psychological stressors, which is shown in the middle here, as well as directly by lectins, such as raw legumes and whole grains like wheat. One way to decrease the lectins and that reaction is to pre-soak those foods overnight or pressure cook them for 45 minutes or boiling them for an hour to get rid of all of the lectins in the beans. And then the biggest caution for the elimination diet is for those with anaphylaxis. You should not have them reintroducing these foods unless they are medically supervised. And even with that, you want to assess the severity of their reaction before considering reintroduction of these foods for those types of patients. Something to note is there is a benefit of whole wheat products. I know that in functional medicine, especially in an elimination diet, there's a lot of times where we're trying to avoid or eliminate wheat products or gluten products for our patients. However, there are some benefits of whole wheat products, such as it contains beneficial fibers. However, there may be some patients that may be sensitive to gluten in wheat products, which can lead to the opening of tight junctions and result in intestinal permeability. Also, you don't have to have celiac disease to be sensitive to gluten. This is called non-celiac gluten sensitivity. And we will be going through that a little bit more in detail here for you here. So what is the mechanism behind gluten sensitivity and how does it affect our body, in particular, our microbiome? In this picture, we can see the gut reaction to gluten and the toll-like receptors shown at the top of the image here. And those toll-like receptors act as primary sensors to gliadin and non-gluten proteins like alpha amylase, trypsin inhibitors, and microbiota-derived signals in non-celiac gluten sensitivity. Dysregulated microbiota also release lipopolysaccharides, or LPS, in circulation, which results in the production of LPS binding proteins, or LBP, from the gastrointestinal and hepatic epithelial cells, along with soluble CD14 from monocytes and macrophages, which is kind of shown at the bottom of the image here. This leads to the activation of transcription factor, nuclear factor kappa, and FKB on the left-hand side there, which controls the expression of an array of inflammatory cytokine genes, resulting in recruitment of neutrophils and macrophages. And how is non-celiac gluten sensitivity different from celiac disease? So in contrast to celiac disease, In non-celiac gluten sensitivity, there is limited dendritic cell activation, resulting in reduced expression of Treg cells and reduced forkhead box P3, shown on the right-hand side of the image, also known as scurfin, which is a protein involved in immune system responses. And all of these factors with increased expression of Claudin-4 culminate in reduced intestinal permeability and increased epithelial barrier. So what basically this means is that there is a smaller reaction of non-celiac gluten sensitivity versus celiac disease. This is why the non-celiac gluten sensitivity is referred to as a sensitivity and not an allergy like it is with celiac disease. In this picture here, you can see the differences between chronic manifestations of non-celiac gluten sensitivity, celiac disease, IBS, and wheat allergy. Notice that with non-celiac gluten sensitivity, patients can experience fatigue, foggy mind, headaches, eczema, and psychological changes. And those were symptoms that were mentioned as a part of the elimination diet and what can help and how that elimination diet can help with some of those symptoms. And then in this picture, we can see that non-celiac gluten sensitivity, it can take hours or days to develop symptoms, while a wheat allergy would be much faster. That's why it can be difficult to determine what you are reacting to dependent upon the specific condition. As I was saying, non-celiac gluten sensitivity, you might not react to these symptoms for days or even hours. And then several studies show that IgG testing is mostly recommended for the evaluation of non-celiac gluten sensitivity, while an IgE is for a wheat allergy, and an IgA testing might be more suitable for celiac disease, and then assessing inflammatory markers for IBS, such as anti-zonulin markers. But anti-zonulin markers are also beneficial for all of these conditions because they remain longer in the blood than just zonulin alone. So when you are looking to evaluate zonulin levels or looking to evaluate these different types of conditions by looking at the markers of zonulin, then you want to look for the antibodies of zonulin versus just testing for zonulin alone, in which we will be discussing in further detail for you in your intestinal permeability and testing trainings. And then here are the references to the elimination diet.